This is the diarthrosis. The way to easy to, way to understand this is just look at this image. This is one bone and this is another bone. So at the end of each bone there is a cartilage, and that is the hyaline cartilage there. Okay. So in between that you see there is a space there, and this is called the joint cavity or the synovial cavity, and the content of that is the synovial fluid. Content of this is synovial fluid. Also, synovial joints have a capsule. So this is the capsule. This is the capsule. So this is made of two layers. This is the external layer, which is dense irregular connective tissue, which means resist forces from different directions. So these are collagen fibers. And the inner layer, this is made of two other type of tissue. One is the loose areolar connective tissue that contains blood vessels, and the innermost layer of tissue, that is the epithelial tissue. The fluid from this area, from the loose areolar connective tissue, the blood vessel that is in the loose areolar connective tissue leaves and then passes through the epithelial layer, and then it goes to the synovial cavity and fills that area. And that is the synovial fluid. So it is a filtrate of plasma plus hyaluronic acid. Hyaluronic acid absorbs water, is very slippery, and that reduces friction. So when these bones move, because of the muscle contraction, there's a cartilage there. This is one way to protect these bones, and another one is that fluid around this area that is very slippery. And if that fluid is not there, then the cartilage can be damaged easily. Also, as you remember, the cartilage does not have blood vessels, so it's getting its nutrient by diffusion. So the fluid here contains a lot of nutrients as well. And finally, there are some immune cells are here. So in case there is infection comes into the cavity or a foreign body, small pieces of the bone or cartilage fills up this area, these immune cells go there and destroy or remove the foreign particles or the infections from that area. So inside the synovial cavity, it is very sterile, no bacteria, no infection, nothing should be there. If there is, then it will cause arthritis, and that can cause damage to the joint. Also, in this area, if there is this tissue, the synovial tissue grows in this area, this is a disease, it's called rheumatoid arthritis, develop rheumatoid arthritis, and that is an autoimmune condition that causes distraction of this part of the joint and the bone, so it will cause deformity. Compare that with the osteoarthritis that causing damage in the hyaline cartilage, and that is because of the wear and tear. If you use it for a long period of time, then this cartilage can be damaged. So osteoarthritis is not inflammatory, but rheumatoid arthritis is inflammatory, and that is an autoimmune condition. Osteoarthritis because of the overuse. Just I want to give you some examples of different types of arthritis. There's also different ligaments that are supporting joints. If you guys remember, ligaments are made of dense regular connective tissue, and they're connecting bones to bones. So there's three different types of ligaments. The most common one is extracapsular, so that's outside of the capsule. Some of them are attached to the capsule. For example, a good example of that is in the shoulder joint, which I will show it to you later. And the last one is intracapsular, that is inside the joint, and a good example is in the knee joint. Also, you see intracapsular in the hip joint. There's also blood vessels and nerves are there. The nerves in the joints have three different functions. One is for pain. So if there's any kind of damage, that will provide information, any kind of physical damage or inflammation, infection, anything. It is important for the position of the joint, so that information is sent to the cerebellum. So you actually consciously understand what direction is moving your joint, but also the subconscious information that is sent to the brain. And even if you don't pay attention to it, that information is processed, and it's important for balance. There's also a stretch receptors are around the joint capsule, and that is also giving information about the position of the joints. We will come back to this later when we get to the nervous system. So I will discuss this in more detail at that time. There is also blood vessels there, and I already talked about that. Those blood vessels provide plasma filtrate for the synovial fluid that is supporting cartilage. There's also fatty pads are there, and that can be between the fibrous layer and synovial membrane, or between fibrous layer and the bone, and that provides a cushion. So it has a physical protecting feature. There is also fibrocartilage in some joints. Those are called articular discs or menisci. Meniscus is the singular form, menisci are the plural form, and they are actually increasing the size of the joints. It is improving the fitting of one joint or one bone on the other bone. It stabilizes the joint, and because of the stability, it reduces abnormal movements. So if the abnormal movements are decreased, then there is less damage to the joint. And a good example of articular discs are a knee joint. Other features that you see in the synovial joint, this is called bursa. Bursae is the plural form. These are sacs or pouches that contains a synovial fluid, and that fluid is coming from the synovial membrane. So they are located in an area of high friction. So anytime there is one tendon or a ligament is near a bone and there is a lot of movements around that area, or if a bone is under the skin, or if a muscle is near the bone, there is a lot of movements and friction in that area. Then you have these bursae, so to reduce damage of underlying tissue. That is the main reason for it. The tendon sheets, they have similarity with the bursae because they are made of the synovial membrane that contains synovial fluid. Same idea there, but they are elongated and they wrap around the tendon. So as you can see here, there is a tendon here, and that is just above the bone. So there is, when the muscle contracts, the length of this may change, and it go over the bone, and they may cause physical damage. So when they are wrapped by these tendon sheets, there is no damage there. There is no inflammation, no pain, nothing. There is an important issue about the synovial joints, because when the joints are mobile, then they are less stable. Some other joints like amphiarthrosis or synarthrosis, they are very, very stable joints. But when it comes to synovial joints, they are less stable because they are more mobile. But there are different anatomical features that supporting these joints and make them more stable. So, for example, you have tendons around the joints, ligaments, muscles, fat, the specific anatomical shape of each joint or each bone. They all give some way a protecting feature for these joints, make them more stabilized. And we can see that examples later on. I will show you some of the examples later. Some of the joints are very, very mobile. For example, the shoulder joint, which is the most mobile joint in the body, or the hip joint is the second most mobile in the body, and they are wrapped around by different muscles and the different tendons of those muscles. So those muscles and tendons give a lot of stabilization around those joints. Without those tendons, these joints can be very unstable. Also, loss of ligaments, tendons wrapped around the knee joints and also in the foot, because there's a lot of weight on those two joints and make them more stable.